Hi, this is Dr. Scott Hoar, and today is Treatment Tuesday, and today our patient is Kaylin Johnson. Kaylin is a student that is also in the Air National Guard, and she's been dealing with some low back pain. So, Kaylin, welcome.
Hi, thanks for having me.
Why don't you tell us what's going on with your low back?
Well, kind of periodically throughout my life, I've had lower back pain because I've done cheerleading, and then I recently went to boot camp and trained for the Air National Guard.
What was that experience like?
It was awesome, and most people don't really enjoy it because it's very strict, but I've always loved to be physically active. It was very rewarding, both physically and mentally. I was in really good shape, and my job is as personnel, so whenever I got back, I was going through all of this movement and exercising and moving constantly and burning lots of calories, and I was in really good shape. And then I got back, and as personnel, it's a desk job, and then I was just sitting. And so I've been trying to do a lot of HIIT training, but with sitting a lot for like 9 hours a day and then only doing like 1 hour of exercise, I think it's really throwing my body and my back off.
Okay, back to neutral. Turn your head to the right as far as you can, and now all the way to the left. Looked to me like going to the right was just a little bit limited. Would you agree with that, or yeah, okay. Any discomfort when you're doing that?
No, it just kind of stops.
Okay. Feet together all the way. Bend over, touch your toes. Good. Any pain, stiffness, discomfort in the lower back?
Lower back, yeah.
Yeah? Okay, come on up. Put your hands over your head.
Like this?
Lean back as far as you can. What did that feel like?
Like pinches a little bit in my lower back.
Okay. Can you point to where it's hurting?
Here.
Right in the center. Does it shoot down the legs at all?
No.
Okay. Turn and face to that wall. Feet together all the way. Rotate to your right as far as you can until you're looking at the camera, actually.
Okay.
Good. And now the left. Looked to me like it was a lot easier to go to the left than the right.
Yeah, I think my right is very limited.
Did you feel discomfort in the low back during the right? What do you feel right there?
No, it's kind of like, it doesn't hurt. It's like it can't go.
Okay.
But yeah, I feel a lot more movement whenever I come over here.
Okay, turn and face the wall. Feet about shoulder width apart. Hands overhead. And squat as low as you can. Maybe a little, yeah, there you go. Is that as low as you can go? And up. And up. Any discomfort with that?
No.
Okay, so the back felt fine during the squat.
Yes.
Good. Try to show me that leg extension move.
Yeah. So I usually have about 10 or 20 pound weight, and it's like a cable attachment, and I go like this. And it's more to target here. Yeah. But sometimes if you're not careful, then you can throw your back out with it.
Sure.
And then, oh, I know this one hurts. So like back extensions, if I'm laying down and like I'm on like a stability machine or something.
Roman chair.
Yeah, I think it's that. And then I have a weight and I go up and I squeeze. It can pinch it's like a pinch nerve almost.
You see that a little bit?
It's curved.
It's not such a straight, so we would call it scoliosis.
I have scoliosis.
You have scoliosis. Right. But you have very small amount of scoliosis. Probably about 30% of the population has scoliosis. So that means you might move your shoulders a little funky, move your hips a little bit funky because of that.
I'm a little funky, so it's whatever.
Exactly, it works. It works. Your right hip is about 7 millimeters lower than your left hip.
Okay.
So you're walking around, I mean, just imagine one tire's a little flatter, one tire's a little fuller, if you were a car. Not that you are.
No, I can tell that. I mean, it doesn't surprise me that it's that way, because it kind of feels like I'm doing this a lot throughout the day, where I'm trying to like get it to balance. And when in the Wii, when you step on it and it like kind of tells you which one's more, it's always heavier on one side.
Yeah.
So
Yeah.
makes sense.
Yeah, exactly. Okay, so we reviewed Kaylin's medical history as well as her x-rays. We saw some imbalances in her pelvis as well as her thoracic spine with a little bit of scoliosis. The neck curvature was down a little bit, so we're going to want to look at all that stuff. We did a movement assessment and we noticed pain and discomfort when she was going into flexion, aka bending her, touching her toes, leaning back, bothered her back, and then rotating her whole body to the right caused some stiffness limitation. I think those are some contributing factors that we want to look at, as well. What was it? Her neck rotation to the one side was limited, and her arm, her right shoulder when she was reaching behind her back was a little bit limited. So a lot of these sound like contributing factors to why there's a little bit too much stress on her low back. So what we're going to do is jump in and see what we can do to help. Ready?
Okay.
How long has your back been bothering you?
I'd say probably the past 2 or 3 weeks it's really been more predominant. But I think once I started cheerleading back in the 7th grade, it's kind of came and gone.
That's really when it started?
Yeah, it's kind of always bothered me, like my lower back, and honestly my shoulders too, just from lifting a lot over my head. But it's kind of recently made its comeback and appearance, and I'm like, why are you coming back?
Well, actually, you don't need to relax at all. You
Okay.
can. It might be more pleasant for you,
Okay.
but that's okay if we don't. All right, so I'm going to go right here, and I am going to do a little thrust into that segment because there's a limitation in the joint, and we want to get rid of that. Okay? All right, ready? Good.
Oh.
So that was your first adjustment.
Yeah.
You okay?
It was great, yeah.
It was good? All right. Your hair's not pulling too much, is it?
No, it's fine. Yeah, this one feels more limited.
Yeah,
And then, like,
for sure.
yeah.
All right.
Oh.
Good. We got a few there, huh?
Yeah.
So we got rid of any restriction in the neck. Now what I'm going to do is a series of muscle tests, and that tells me what's doing well, what's not doing so well in your body, okay? I'm going to push down.
Okay.
Don't let me do that. Very good. Any discomfort? Put your thumb and your pinky together. I'm going to pull them apart.
Okay.
Don't let me do that. Ah, ready? Not so great, huh?
Okay.
All right, so the nerves that control those muscles come out of your neck right around here. So what I'm going to do is an adjustment right there,
Okay.
and that helps to press a reset button. Good. Thumb and pinky together, pulling apart. Much stronger, huh?
Yeah.
And that's what chiropractic is. Okay, finding dysfunctional areas or imbalances and restoring them. And the suddenness and the quickness stimulates the nerves in a way where it presses reset and reestablishes normal function, aka in this instance, normal strength. And that stabilizes your body to protect it.
That's fascinating.
Yeah. Elbow in at your side.
Okay.
What I'm going to do is pull out that way.
Okay.
Don't let me do that. Very strong. Make a fist. I'm going to push down. Don't let me. Very strong. Okay. Make a fist. I'm going to push down. Don't let me. Awesome. Thumb and pinky together. Pulling apart. Don't let me. You knew that was going to be bad, huh?
Yeah.
Okay. All right, so the same sort of thing.
Okay.
Upper neck, right around there. So we're going to adjust that. Very good. Thumb and pinky. And it's stronger, but it's still a little weak, isn't it?
Yeah.
So let me see what I can do. Sometimes that indicates something off with some of your wrist or carpal bones. Okay, thumb, pinky, pulling apart. Still a little weak. So now I'm feeling for your wrist bones to see, are they all moving the way they should? Any discomfort right there? Good. Okay. Now I told you, it's all about the speed that makes this work. So what we do is we use a board like this because I'm about to adjust your wrist, and I want to make sure it doesn't hurt at all. Good. Thumb and pinky, pulling apart. And there we go.
Oh, better.
Elbow in at your side, pulling out there. Don't let me. Again. Pretty good. Make a fist. I'm pushing down. Don't let me. Good. Make a fist. Pushing down. No, that's great. Okay, so a lot of things firing just really well with your upper body. One of the things we always want to do, though, is make sure your thoracic spine and rib cage is moving really well, because if that's stiff and limited, that adds more stress to your lower back. So we're going to do a mid-back adjustment. So kind of like I did with your neck right at the beginning, I'm going to feel for any restrictions or limitations in your back. And right there, I definitely feel it. And you feel it too, yeah? So what's going to happen is you're going to put your chin to your chest, kind of like a sit-up. Good. I'm going to grab you here, and then I'll give you a little thrust, okay? Deep breath. Breathe out. Good. All right, muscle test. Pushing down.
Okay.
Don't let me do that.
Okay.
Ah! Come on, other side. Pushing down. You see that difference?
Yeah.
Okay. All right, so your hip flexor just tested weak. The nerves that control the hip flexor come out of your spine right around there. So what I'm going to do is, well, that. Okay, a little bit more. Ready?
Yeah.
Very good.
Yeah.
Pushing down, don't let me. There you go.
Wow, that's like magic.
Yeah, right? Muscle test, I'm going to push down and out. Don't let me.
Oh, okay.
Good. Down and out, don't let me. Ah. Okay. All right, breathe out. Good.
Ooh, that was a good one.
Yeah. Muscle test, pushing down and out. Way better, yeah?
That is way better. Yes.
Good. All right, muscle test, I'm going to push down like so. Okay. Don't let me do that. Really good. Pushing down, don't let me. Really strong. Raise your knee up. I'm going to push your knee into the table. Don't let me do that. Really strong. Knee into the table. And that's not as strong. Okay. You can tell, yeah? Yeah. So the glutes tested weak. Kaylin. All right, and the sacrum right here. Remember we said the sacrum was rotated? Yes. The nerves that come out of the sacrum are what control that. So we're going to go press a reset button on that.
Reset.
That's right. Deep breath. Breathe out. Good. Hold it right there. I'm pushing down. You see the difference there? Yes. That is rock solid, right?
Oh my goodness.
So why we're looking at your feet is, your feet, especially your toes and your ankles, are your huge shock absorbers of your body. And if there's stiff or limitation or dysfunction for any reason, then it alters how you move your hips. If it alters how you move your hips, that's going to put more stress on your lower back. So we want to make sure everything's doing okay down here. Okay. So I'll do some muscle tests here. Okay. So bring your foot up and in. Hold it right there. I'm going to push down and out. Don't let me. Awesome. Point and in. Hold it right there. I'm going to push from there. Okay. Don't let me. Go. Really strong. Point and out. Hold it right there. I'm going to push from right there. Don't let me. Really strong. Up. Up a little bit. Out. And out. Hold it right there. I'm pushing down and that way. Don't let me. Go. And not so good. And that led to a little click there, didn't it?
Yeah.
Good. Yeah. Good. Up and out. Hold it right there. Push from right here. Don't let me. And it's a little bit stronger, isn't it? Mm-hmm. Good. Let's switch feet. Up and in. Hold it right there. Push from right here. Don't let me. Really good. Pointing and in. Hold it right there. I'm pushing right there. Don't let me. Great. Up and out. Hold it from right there. Push from right here. And that's not as strong, is it? Actually, it was the same one that was weak on your right foot, right?
Yeah.
And what I'm feeling is a little bit of restriction in your heel, actually. See, it goes in really nicely. Going out, it doesn't. Can you tell?
Yeah.
All right, so what I'm going to do, this is going to look scary, is I'm going to pretty much punch your heel.
Okay.
And I can already tell it's moving better. Cool. Back here. Up and out, hold it right there. Push from right there. Much stronger, yes? Pointing and out, hold it right there.
Wait,
out,
which way?
yeah.
Okay.
Push from right here. Strong. So, hug your hands to your, yeah.
Okay.
And what you're gonna do is you're gonna raise your butt up off the floor.
Okay.
And then I'm gonna bully you around.
Okay.
There's two possible outcomes. Number one, you've got good control and stability. It looks like this. Number two, you don't. It'll look like that.
Okay.
Let's put this on this side. All right, so raise your butt up. Not exactly great, right? All right, relax for a second.
I thought I was going to do better.
So let's try something.
Okay.
Put your knee toward your chest. I'm going to push your knee from out to in, and I want you to resist that.
Okay. With my butt up?
No, not
Okay.
yet. Good. Just resist it like that, and now raise your butt up off the floor, and I'm going to push. It's not great. Okay,
Okay.
down. Your right fist, put it up in the air towards the ceiling. What I'm going to, keep that knee up. What I'm going to do is push down, and now raise your butt up. Still a little bit off when I go that way. Did you feel more stable when we were doing the fist thing, or when I was pushing on your knee?
The fist thing.
And raise your butt up off the floor, and down. What's happening here is the kettlebell is stabilizing your body.
Okay.
You're right, it's a core stabilizer. And then you're restoring proper movement to your hip without low back motion that might cause harm. Okay, so we're improving your core stability of your back. Switch arms and legs.
Wait, right? Nope. Yep. Okay. Do it again.
Yeah,
That one feels a lot stronger.
exactly. That's your imbalance. So
Okay.
it's like when you were twisting to the one side,
Yeah.
and it was fine, and you twisted to the other side, it wasn't. Because this is actually an anti-rotational exercise. When you raise your butt up, your body wants to fall to this side, right? So you're learning how to not let it. And up.
Oh, wait.
Yeah, just do 10.
Okay.
You're going to shift your weight towards your heels and stick your butt back till you tap the wall, and then stand up straight. And then if you do it successfully, you get a 1/4 inch away from the wall. And eventually, you really have to shift those hips way back, which is what hinging at the hips is.
So, like this.
Yeah.
And then move up.
Yep.
And then move up. Okay.
Yeah.
Move up. Okay.
Harder. Faster. Good. Engage. Engage. That's perfect. Good. And down. Number one, how does your low back feel as you're doing this?
It doesn't hurt.
It doesn't hurt because you're extending through your hips because we activated them during the single leg bridges. We made sure we're hinging correctly during the butt touch game. And now you're understanding how to actually move your body well through your hips while you're having a neutral spine. And that's why it feels good. 2 more. Last one. All right. Nice. You didn't think you were going to work out at the chiropractor's office, did you?
Yeah. Hi, it's Kaylin, and I'm doing a 24-hour post-treatment follow-up video. This morning, whenever I woke up, I kind of just felt like I could move around more. I wasn't as stiff, and I think that had a lot to do with the chiropractic treatment with Dr. Hoar yesterday. Overall, my experience was a 10 out of 10. I thought I was going to go in there for like 20 minutes, and he was just going to pop me here, but the overall experience, like they did x-rays, and then I had scoliosis. I didn't even know I had scoliosis, and I didn't know my hips were uneven, and he was very thorough and educating throughout the whole process, and I'm very excited to continue treatment
with Dr. Hoar, and hopefully take preventative measures with my body, since I am going to be very physical, hopefully, for a very long time. So thank you again, Dr. Hoar, for helping to grow out, and I really appreciate it.